Hello, good morning. My name is Bev Everton. I'm a registered general nurse who works within the continence field. I'm a bladder and bowel nurse specialist working for Wellspect Healthcare. Once a month I attend a clinic here at the MS Centre, which we'll give you some more details of later on. My contact details are on the screen now, so if at any point you'd like to give me a call to ask for any specific help, then I'll be more than happy to take your messages. What we're going to do today is we're going to actually look at promoting continence. Suffering in silence should not be acceptable, and I think that many people who suffer with MS do actually suffer in silence for quite a long period of time before they actually feel it's appropriate to seek help in some way. So what we're going to do is we're going to look at some bladder issues, bowel issues, and potential solutions that may well help you, and also give you some options of where you may be able to find some help if you're not able to access the information that I can provide here at the clinic. So bladder issues. There are many bladder issues associated with MS, and I think probably a few of you will be able to relate to the fact that you may well have had a bladder issue long before you had a diagnosis of MS. And this may well have shown itself in the way of frequency, so getting that urgent need to go to the toilet and having to go very frequently, or urgency where you need to go and it's the call is very quick and you need to dash to the bathroom. These can be problems that can give you other issues where maybe you're not able to get there in time because maybe your mobility is reduced, or maybe your dexterity in your hands has reduced and therefore you're not able to actually access your clothes quite as quickly as you've been able to in the past. Limited mobility can also cause an issue, which will then allow you to suffer with problems because your bladder is showing the urgency and frequency signs. There's just some pictures. There's a picture on the screen just showing some of the products that are readily available, and we will go through these later on in the webinar for to discuss some other options that are available. But quite often, initially, people will be offered pads as a solution, and I'd like to think that actually it's not acceptable for you just to be able to walk into a Tesco's and manage your own incontinence with a packet of pads from the shelf, that we should be able to help you to actually promote being continent again and not necessarily have to live with an incontinence problem. Depending on your level, the type of MS and where you are within the disease process, you may well also suffer with fatigue, and bladder issues can also affect that, because if you're having to get up several times in the night to go up to the bathroom because of this urgency or this frequency, you can find that you're becoming very tired. And that will also affect how you are in the daytime and may well also affect other of your MS symptoms. So fatigue can be a big issue and can be affected by the bladder. I'm going to look at male and female separately now, so just to show you some of the solutions that we might be able to offer. And I think one of the first things that we should look at as a solution would be toileting, making sure that you're actually going to the bathroom regularly and actually making sure that you're sitting or standing there long enough to make sure that your bladder is empty. We haven't looked at diet and fluids yet, but diet and fluids can have a big impact on your bladder, and fluids should not be restricted just because you feel it makes you go to the toilet more frequently. So I would suggest that, obviously depending on the size of yourself, we would actually consider how much fluid would be an accepted amount, and that would be for both male and females. Also, other types of fluids can have an impact on your bladder. So sometimes overloading our bodies with caffeine, so maybe too much tea or coffee, or even some of the dietary or non-dietary drinks like Coca-Cola, sorry that sounds like a brand name, but Coke or something like that that have got caffeine in them, then they can actually have an effect on your bladder too, because they can start to be an irritant. And you may well find that by reducing the amount of caffeine that you have, you may well find that your urgency and your frequency is lessened. Restricting fluids will not actually help the problem, because if your bladder is irritated, by reducing the amount of fluid you take, you will actually cause more problems, as opposed to taking in more fluid. You may need to go to the toilet more frequently, but you will be ensuring that your bladder is being cleansed very, very frequently. So toileting is actually one of the initial things that we would suggest as part of conservative bladder management. For men, we could consider using a urinal, so either a disposable or a reusable urinal. So in terms of somebody being in hospital, they talk about a bottle, so a shaped piece of plastic or paper mache that can actually fill the urine, and then that can be emptied frequently. This may allow your dexterity issues to be overcome, because you may not have to keep getting up and going to the bathroom quite so frequently, but it will actually allow you to keep control of your own bladder, because you can dictate when you go to the toilet into the urinal, and then it can be emptied away afterwards. The only thing you need to consider there is obviously privacy. So is it a private place that you can actually use the urinal? And also, are you going to be able to empty it? And also, are your clothes accessible enough to be able for you to access your penis to be able to use the urinal? Another type of product available is the penile sheath, and there is a picture of a penile sheath to the right hand side of the picture, and these come in many different shapes and sizes and different materials, but generally the materials are non-latex, and they're used, the sheath itself is rolled onto the end of the penis and along the shaft, and then attached to the open end of the sheath would be a leg bag or a night drainage bag to allow the urine to be directed away from the body. The particular product that's on the picture is a self-adhesive product, so as you roll it, the adhesive sticks to the shaft of the penis. And if a penile sheath is something that may be considered for you, then we would look at different products that are available, but really the key is the size to ensure that the penile sheath is going to fit correctly. If the penile sheath is too tight, obviously that can be quite restrictive and uncomfortable for you, and if it's too big, what can happen is, as the urine is directed away from your body, it can actually backflow along the shaft and cause the adhesive to be removed. The wear time for a penile sheath is 24 hours, so you would need to change it every 24 hours, but it means that you could actually use it for a whole day and a whole night. And some people will change them first thing in the morning, and some people will change them at night. And also another option would be that a sheath is just worn at night time to save having to get out of bed. Which again would be fitting in terms of what we just talked about regarding fatigue and being woken up frequently. So a penile sheath is an option for men. Indwelling catheters are a consideration, but what we do need to consider if somebody is using an indwelling catheter would be the risk of infection, because within the first 24 to 36 hours there will be bacteria present, which could potentially lead to a symptomatic urinary tract infection. And urinary tract infections can be quite difficult to overcome. It may well need antibiotics, and you may well find that your MS symptoms are greatly exacerbated by having a urinary tract infection. Another option potentially would be to look at using an intermittent catheter, and there's a picture of an intermittent catheter also in the middle of the screen. And the picture is actually of a male length catheter, which is usually around about 40 centimetres, and an intermittent catheter, as the name would suggest, is used as an in-out product. So the catheter is inserted, the urine is drained from your bladder, and then the catheter is removed immediately afterwards, therefore reducing the risk of infection because the catheter isn't sitting there for a long period of time. The other key thing with somebody doing intermittent catheterization is, the bladder is empty, so therefore any urine that's been previously being left behind is being removed, so therefore not causing an irritant to the bladder. The other thing of using an intermittent catheter is that the bladder will keep its tone, so therefore it will continue to work as a muscle. filling and stretching, and then as the urine is removed, reducing back down again in size. So therefore the potential would be that you're maintaining bladder health, that eventually maybe you could stop using the catheter altogether. If during the disease process a catheter is suggested as an indwelling catheter, you may well be asked to consider a suprapubic or a urethral catheter. And a urethral catheter in a male would be a catheter inserted down the shaft of the penis and left in place, and then at the end of the catheter a leg bag or a night drainage bag is attached to that. There is also a potential of something called a catheter valve, which can be put in the end of the catheter, allowing the bladder to maintain its bladder health by allowing it to fill and empty naturally. And that is almost like a little tap that's put on the end of the catheter. And again, that's something that could be discussed as a potential for you. A suprapubic catheter is a catheter that's inserted into the abdominal wall and is inserted into the bladder from the front of your body, allowing your penis to remain catheter free. And again, for somebody who's using catheters long term, it may well be a consideration, although we do need to consider the evidence around catheter infections, which again are greater in people with indwelling catheters. Towards the end of the list now, I've talked about pads, and there was a picture of some pads on the last slide. And pads come in all different shapes and sizes, and there's male versions and there's female versions, and there's those that you can just pick up in Tesco, as we've previously talked about. I personally believe that we should be able to offer an alternative to pads, but obviously in some cases pads will be of benefit to you if it just gives you the confidence to allow you to go out and keep mobile, by knowing that if you do have a little accident, the pad will actually protect you and protect your clothing. The pads these days are very, very good at keeping the urine away from your skin, so reducing the risk of skin soreness and things. And also they have quite good capacities now in terms of how much urine that they will actually hold. One of the things to consider if somebody's going to be using a pad is, are they leaving any urine behind when passing full voids of urine? Because if there is a residual, then we would need to look at ways of removing that. The last point on the slide is a product called a retracted penis pouch. It's made by a manufacturer that, and it's basically a flange that is fitted around the genitalia as opposed to onto the shaft of the penis, and this will actually direct the urine away from the skin in a similar way to the sheath, but it actually is fitted round as opposed to on the penis. A retracted penis pouch is suitable for people again with dexterity problems, and we just need to consider things like pubic hair to ensure that the product will actually stick and remain in place, because we'd want you to be confident that the product was going to work for you. Depending on how much urine is being passed into it would depend on whether it could just keep the tap on the end of it, and maybe it could just be emptied in that way when you go to the bathroom, or whether a leg bag and night drainage bag system is also considered to be used with a retracted penis pouch. So some options there for men to consider, and there are many, many more, but this is just giving you just some basic, hopefully, information and confidence to know that you're not alone and that things could be considered to help you if you're having problems with your bladder. Moving on to ladies now. Some of the solutions are very similar to men, but we'll go through them all individually again. The initial one would be toileting, which we've already talked about. I think if you're in a wheelchair, this can sometimes cause issues. It may well be that you need to be hoisted, or if you're not able to transfer and things. But toileting and going to the toilet regularly would be our first consideration with regards to what we would call just in the basic process of conservative management for your bladder. There are female urinals available. We talked about male urinals in the last slide. There are female urinals available which are shaped specifically to fit against the female genitalia. and basically they work by just literally pressing against the skin and then allowing the urine to be passed into it. Some of them have got directors on the end so that you can actually direct the urine, or you could actually attach them to a night drainage bag to catch the capacity that's being passed. Female urinals, what you need to be able to do is actually be able to be in a position to yourself or somebody to hold it in place for you, because it's very important to get the seal against the female body, because unlike a male, we don't have, our genitalia doesn't allow us just to put a penis into the top of the urinal. So it's very important to be able to get a good seal to ensure that you don't get leakage. There's several products available on the market which we can look at later in terms of access to these types of products. But as I say, generally it can be a urinal which will catch the full void, or it can be a director to actually allow the urine to be directed away from the body. Again, catheterization may be a consideration. And again, we need to consider the potential of a urinary tract infection, which may well affect your MS symptoms. And as I said earlier, just a couple of days for a bacteria to be present, which may potentially cause you to have an asymptomatic or a symptomatic urinary tract infection. And again, that can affect your MS symptoms. Intermittent catheterization could also be considered, and to the right of the picture there is a picture of a small intermittent catheter for ladies, and this basically is inserted into the urethra. With a lady, the urethra is significantly shorter, and as I said at the beginning, a gentleman's catheter is usually around about 40 centimetres. With a lady's catheter, it's significantly shorter at around about 20 centimetres, although there are even shorter products available on the market. And what we're looking to do is insert the catheter into the urethra, allow the urine to be drained from the bladder, and then the catheter is removed. On the centre picture, there is actually a gripper which can be used to actually insert the catheter if your dexterity is that you can't actually hold on to the catheter. The catheter on the picture to the right has got quite a large funnel end on it, so it's quite easy for you to hold on to. Even with dexterity problems, you could actually grip that into your fist, or you could consider using something like the gripper on the picture, which will actually hold the catheter stable for you while you actually insert it into the urethra. So these are types of things that may actually be able to help you to consider using intermittent catheterization as opposed to having an indwelling catheter. Towards the bottom of the slide, again, suprapubic catheter is mentioned, and that can be used in a lady and a man or a gentleman. And again, we just need to consider the risk. In terms of the catheter itself, it is inserted via the abdominal wall, and it will need to be changed regularly. Patients still at risk of a urinary tract infection with a suprapubic catheter, so we just need to bear that in mind, because that again can affect your MS symptoms. Pads are also listed here because it's something that we should be considering for you, but I feel that if you are going to your local supermarket and buying your own pads, then it may well be worth looking at getting some specialist help from the Continence Advisory Service, which we'll look at later on in the presentation. But pads can, again, give you the confidence to be able to go out, but I don't actually see it as being the answer to everything, because we hopefully will be able to help you promote the continence as opposed to managing your incontinence. I don't think people find bowels quite so easy to talk about as they do bladders. And just going a little bit off track, bladders, I think it became a lot more acceptable to talk about having a bladder issue when children started having trampolines in the garden and mums started bouncing around on them and suffering with stress incontinence. And I think it became much more acceptable to be able to talk about having a problem of maybe a little leak of urine. But bowels, I don't think we've actually got there yet, and actually people feel confident and brave enough to discuss that they've got an issue with their bowels. I think it's probably fair to say that you only need to have one bowel accident to never ever forget it. The embarrassment and the frustration that that could actually cause to you. And so therefore I think it's important that we can actually try and assist you in initially trying to gain some kind of routine. And lots of people who I've spoken to with MS have said to me in the past they had a bladder and a bowel problem long before they had a diagnosis of MS. And I think that's exactly right. The neurogenic side of the condition has affected your bladder and your bowels, and actually it's been quite difficult to get into some kind of routine. So I always would try and encourage somebody to keep some kind of bowel chart to actually look at what their normal is, because everybody's normal is different. And certainly in the bowel world, we talk about normal as being anything from going to have your bowels open from 3 times a day to 3 times a week. Now, it may well be that you go to the toilet once every 10 or 12 days. The problem with being constipated or having a very long bowel regime is that the toxins that are present in your body can actually make you feel absolutely rotten and poorly, and it will also affect some of your other MS symptoms. So the fatigue may seem worse. We can end up with smelly breath. Our skin can look sort of dull, and that can be due to the toxins that are present in our bodies by not actually having our bowels open regularly. So the important thing is to try and see what your normal is and see if we can increase that. With bladder and bowel care, I think it's about what is considered to be acceptable for you, because everybody is different, and I think an expectation is what we should try and manage, and actually gain an expectation that is realistic. It may not be realistic to expect you to have your bowels open every morning at 8 o'clock if that doesn't fit in with your lifestyle. But what would be considered to be a normal routine and regime for you is with an expectation that is realistic. The picture on the right looks quite horrific. I'm sorry about that. It's actually a picture of an irrigation kit, and I don't want to scare anybody off with it, but it is one of the options which we'll look at as we go further through the presentation. And that's where water is inserted into the bowel to actually help you establish a normal regime. One of the things people talk about when we've overcome the embarrassment of having a bowel issue would be things like odour. If someone has a bowel accident, generally people are aware of it because there tends to be an odour associated with bowels. And that in itself, hand in hand with embarrassment, can actually lead to people eventually becoming feeling that they're able to come forward and actually seek some help. And I want to just assure you that there is help available if you are having issues with your bowels. So please don't be embarrassed, and see if we can seek some help so that we can try and aid your problem and manage your expectation of what would be acceptable for you. This slide is a little bit busy. It's actually what we call a hierarchy of intervention, and whenever we look at people who are having issues related to bowel management, this is something that we may consider. And at number 1 at the bottom of the pyramid, we look at what we would consider as conservative bowel management. So the routine that we've already talked about, diet and fluids that may well affect you, lifestyle alterations. Are you being prescribed laxatives from your GP? Or are you taking medicines that are actually causing you to become constipated? And I'm sure that several of you do actually take medication which may well have an effect on your bowels. Routine I've just spoken about. Diet and fluids is very important. Certain things will affect certain people's bowels, and some people will know that if they eat sweet corn that they'll be able to trace exactly when they have their bowels open, and that actually can assist us with learning what our own transit time is. So from eating to actually passing, we can actually work that out. With somebody with MS, your transit time will be slower than prior to MS because of your neurogenic bowel that you're suffering with. So don't be alarmed by that. But it's important to remember to have diet and fluids regularly, I know that sometimes if you have too heavy a meal, that can affect your fatigue, but it is important to eat and drink regularly. Second step on the pyramid are rectal interventions. So it may well be that you talk to digitally stimulate to remove the feces. It may well be that you actually have to digitally remove the feces from your rectum using your finger, or it may well be that you use suppositories or small enemas. And these are considerations that you may need to look at to actually get you into that routine and to that acceptable form of management for yourself. The problem sometimes can be that some of the stimulants do exactly that, and they will stimulate your bowel and then they will continue to work. So you may well have a bowel result having used your laxatives or your enema or your suppositories, but then you may need to go again a little bit later on, and so sometimes that can be an issue in itself. So it would be a case of working in conjunction with your GP or your continence nurse or your district nurse to actually see what is going to work specifically for you best. Third up on the hierarchy of intervention is something called transanal irrigation, which I'm going to look at slightly separately in a little while. But transanal irrigation is where water is instilled into the rectum and then into the bowel to actually stimulate peristalsis, which is the natural movement of feces around your body. Going further up the pyramid, we then get into the things which have got a lot more intervention associated with them. So the possibility of an antegrade colonic irrigation where water is inserted through the abdominal wall, or possibly nerve stimulation, sacral stimulation, or even eventually the possibility of stoma. And I think that that is quite a way down the road. So I think what we need to be talking about today are the first three steps on the pyramid, which will actually allow you to have a regular routine for your bowel management. So some of the solutions that we might want to talk about, toileting again is very, very important. So actually going and sitting on the toilet, and toileting position is also key. The key thing is to ensure that you're sitting, one, comfortably, and also that your feet are slightly raised off the floor. When we had our children and we used to get them the little step that they used to step onto to be able to reach the toilet, that's actually ideal for us now. That would be the ideal sitting position, that you actually get onto the toilet and then raise your feet onto that little stool. Maybe well, we don't have the fat telephone directories anymore, but when we had the old-fashioned telephone directories, that sort of height would just give you enough to raise your knees above and allow you to be in the perfect toileting position to empty your bowels. The conservative management we've just talked about, the diet, the fluids, the possibility of some laxatives and some medication from your GP. That will vary from GP to GP as to what their preference is, and certain things will work for certain people much, much better. But ultimately what we're looking to do is to get you into some kind of regular pattern that you can manage. I'll sometimes see people that take medicine to make them go to the toilet and medicine to stop them from going to the toilet. And I just feel that sometimes we haven't quite got the balance right in that situation, that people are having to take tablets to go and then tablets to bung them up again. So it may well be that you just need a little bit more assistance and a little bit more advice if that's the case with yourself. There are something on the market which are called anal plugs. They actually look, when you first get them out of the packet, very similar to a small tampon. They're not a ladies' product. They're suitable for male and female, and they are inserted into the rectum. And the key to fitting is to make sure that you put it in past the internal and external sphincter, which is situated in the lower part of your rectum. And if somebody suggests anal plugs, then they will actually go through the correct fitting of them for you to ensure that, one, they're comfortable, and two, that you can actually wear them for a specific period of time that is suitable to your lifestyle. An anal plug can be worn for up to 12 hours at a time. But the key thing is, if you've not put it in far enough, you may well be aware of the fact that it's there, and your body will actually try to pass it. So the key is to ensure that it's in. When it's inserted, it then opens up by using the mucus that's naturally in our bowels, and that will cause the coating to dissolve, and the product itself will open up like a mushroom and will sit there and hold both fecal liquid or firm feces in place until you actually remove it. You can actually wear them continuously, just needing to change them every 12 hours. But the really important thing is to remember to remove the anal plug to allow you to have your bowels open regularly as well. So that would all be explained to you if somebody was considering an anal plug for you as a suitable form of management. The picture on the right hand side is an anal irrigation product. This is a product that's got a catheter attached to it, which has got a balloon, which when the catheter is inserted into your rectum, the balloon is inflated, and therefore you can then remove your hands, and then the water is instilled using the pump, which is also shown on the picture. There are other products available on the market, both with a catheter system to instill them, or also a cone system, which was similar to that on the picture earlier of the aromatic pump. And a cone system is literally inserted into the rectum and the water is instilled. The benefit of that is it doesn't overstimulate your bowel, because sometimes a catheter can stimulate and cause the bowel to spasm and cause you to try and pass the catheter, whereas the cone can just be held in place, and even if the bowel does spasm, you can actually still hold it there. What it does, the water will actually stimulate peristalsis, which is the natural movement of feces around our bowel, and what it will do is it will cause a natural peristaltic movement. So the water will cause extra peristalsis to happen. With your MS, we've already said that your transit time is slowed, and by putting the water in, it will actually just almost give your bowel a little extra kick of encouragement to move the feces around. By using the water regularly, any feces sat in your bowel will actually become softer by the water being added into it. So even if you don't have a bowel movement on the day that you've irrigated, the water will be being beneficial to your bowel by making it softer, so that when you do eventually pass the feces, it's easier for you to pass. Some things that you just need to bear in mind is that a bowel assessment will need to be completed by your GP or your nurse or your specialist nurse at the hospital to ensure that you are suitable for irrigation. It should actually reduce the amount of time that you're taking with your bowel management to maybe somewhere between 10 to 40 minutes for the actual irrigation process, and in terms of you actually having your bowels open. It varies from person to person, so it's quite hard to actually say very specifically how long it will take for you to use the irrigation itself. It's just water, so as I said earlier about some of the stimulants, they can carry on working. With irrigation, what tends to happen is you tend to have your bowel movement, and then you're finished, because it doesn't carry on stimulating, because it's not got any chemicals in it. It's purely tap water, and it's just used on a regular basis to establish some kind of regime that's acceptable to yourself and whoever it is that started you off to use anal irrigation. It seems quite a drastic thing to do, but actually it can be very, very beneficial to people, because it can actually give them control back, because they can actually say when they want to go to the toilet and know that once they've been, the bowel is emptied enough to give them the confidence to know that they won't have an accident while they go out shopping or wherever. So it's quite a good way of managing and allowing people to get some of their freedom back. Just going to look at some of the physical aids that may well be accessible for you to consider in the next few minutes, of the last few minutes of the presentation before we take some questions. But some of the physical aids you may well already have in your home or may well be considering. But I think if you're starting to have problems with dexterity and mobility, certainly one of the first things that is usually introduced for you is maybe a raised toilet seat. And that can be just a mobile raised toilet seat that's put in and just put over the top of your toilet seat to make it easier for you to be able to go into the bathroom and continue to look after yourself independently for as long as possible. I think just something to consider if you're looking at a raised toilet seat, if you're going to consider some of the other options that we've talked about, particularly things like irrigation. For inserting the catheter or the cone, you do need to be able to access your bottom. Sometimes a raised toilet seat can kind of get in the way a little bit of that, but it's something that can be overcome very, very easily with the help of the nursing staff who are going to teach you to irrigate. Commodes are another thing that could be considered. It may well be that a commode is put in a downstairs room so that you can actually use that as your bathroom during the day if you're on your own, if maybe your partner's out at work or something. So you've actually got somewhere where you can still go to the toilet if you can't manage to get up and down the stairs during the daytime safely, because obviously we need to consider safety. So commodes are another option. Some people don't want to use a commode in their dining room or whatever, and I fully understand that, but it is just another option that can be considered. Some of the other products that are physical things that may be able to help you just generally may be things like shower chairs or closet mat toilets that actually do your bottom cleaning for you on the closet mat. Shower chairs can be beneficial, that you could actually use a shower chair over the toilet, and then as soon as you've done your bowel regime, you could then be put straight over, move it straight across over into the shower to save actually having an added transfer. A lot of the shower chairs now have got the ability to be able to fit over the toilet, so that's something that you may want to consider as opposed to a commode or a raised toilet seat, because it may well just mean that you're having to do one less transfer from going to the loo before you can actually get into the shower and get yourself cleaned up and freshened up for the day ahead. Closet mat toilets are, as I say, they do actually clean and dry. They wash and dry your bottom for you. Depending on where you live, some OTs will be happy to sort of recommend that this is a suitability for you, and if you're able to just have a look at that, then it may well be worth just popping closet mat into Google and seeing a little bit more information about it. There are also things available called bottom wipers, which are really an extension for your hand, and what you would do is pop the toilet paper into the bottom wiper and control it with your hand, so it just gives you a little bit of extra reach if your dexterity is limited. These types of products are available on the internet, and there's actually a company quite locally, which I'll talk about later, who also will supply these kinds of things in the Bristol area. I think very importantly, and it may be something that's just automatically happened, is things like handrails and anti-skid mats available for you to actually aid your safety while transferring onto the loo and maybe from the shower and things like that. These can be very, very beneficial, and actually may mean that you can continue to use the normal toilet as opposed to having to move over to use a commode unnecessarily. So these types of products are available, and usually the OT will be able to help you or direct you with that if you're not able to sort them out, to source them for yourself. So where are you going to go to access the help? I think most of us will know where our local GP is, and you may well already have access to your district nurses. So sometimes it can be worth having a conversation with the district nurse if you've got issues around continence. Some of them within the team, there'll be somebody who has got a continence interest, and who may be very willing to help you and give you assistance to find the suitable assistance that you require. But all of us have access to a local community continence advisory service, and in some areas there's also accessibility to a hospital continence advisory service. Probably the best thing to do would be to actually Google your local area to find access to who your local team is. And a lot of the continence advisory services based in the community will have an open access policy where you can actually contact them directly and arrange an appointment. And they will usually then send you out an appointment and you can do a direct referral. In other areas, you will need to go to your GP to get the referral done so that you can ensure that you're going to be seen by the correct people. Sadly, it will depend where you live as to how long these appointments take to come through, but I think generally anything up to about 6 weeks is probably an acceptable wait, although that might seem quite a long time. And in some areas it may well be shorter than that, and it may well be that in that 6-week period you'll be asked to complete maybe a bladder and or a bowel diary depending on your symptoms, and so that when you do actually see them you've already got the first lot of information available so that they can start the assessment process for you. And that would involve some questions around your symptoms, and then they may well look at taking that forward to suggesting other forms of management for you for the issues that you're actually suffering at that time. The MS nurses as well may well be an access point to access help around continence. Certainly in the Bristol area we're very, very fortunate that the MS nurse has a continence interest, and people are managed very, very well in the locality. In other areas your MS nurse may well be your first link, who will then direct you into where the issues are. I think sometimes your appointment with your MS nurse can be a very busy appointment because she's trying to deal with all of the aspects of your MS, and continence is just one of the small areas of that. So don't be alarmed if your MS nurse does offer to send you to some specialist continence service, because you'll be able to then access the help that you deserve. Thank you. I'm actually just going to talk about the MS continence clinic that we offer here at one of our the MS Therapy Centre in Bristol. I offer a clinic usually around about every 6 weeks, the next one being on Wednesday the 24th of June, and I'm usually here between 10 and 2, but obviously if we get inundated with appointments we can extend that. If you'd like to make an appointment to meet with me to discuss anything at all in the clinic situation, then the telephone number is on the screen now and you'll be able to gain access to an appointment, and I look forward to seeing you. You may want to speak directly with one of the centre physiotherapists. Again, that is the same telephone number. But my contact details are on the screen if you want to contact me directly. That's I don't have an issue with that. There's my mobile telephone number and my email address, and I will get back to you as soon as I can. Thank you very much. I'm now going to take some questions. I've got a couple of questions on the screen already now. The first one is from a lady called Dora, and she's asking, how can people with MS access the right continence aids for them? And I think we've kind of just covered it in a way with regards to the continence advisory service, or from the MS nurses who may well be able to direct you. Locally, I'm not actually sure where you live, but locally there is a company called Dismit Medical. I'll put it onto the screen at the end so that you can actually access that. Dismit Medical is a company who has many continence aids that you'll be able to look through on their website, and those are products that you would actually need to purchase yourself though. Your GP will know which products are available on the drug tariff, which would then be prescribable. So you can, that would be the continence aids that will be available for you. Another question would be, as a carer, are there any signs that we can look out for if a person with MS has a bladder infection? I think it's fair to say, depending on the management of the individual, so if they are, what I mean by that is how they're actually being managed. So has the person actually got a catheter in situ? If they've got a catheter in situ, an indwelling catheter, the signs and symptoms would be maybe that the urine is becoming quite dark, it's quite smelly when you're actually emptying the leg or the night drainage bag, and also there may well be less urine than you would normally have. Other things may well be that the individual is feeling slightly unwell, maybe got a slight temperature, maybe more tired than normal, and maybe their symptoms of MS are actually being affected, and they may well seem that the symptoms are slightly worse than they normally are. So those would be the initial things to look out for. Also, if someone has got a catheter, the bugs are present, and as I said earlier on, so it's a case of ensuring that plenty of fluids are taken, and if a catheter's there, ensuring that as much fluid is going in is coming out. So that should actually ensure that the urine becomes a much lighter colour as opposed to it being darker with the signs of the infection. There may well also be some lower back pain, which hopefully we won't get to that stage. That may well be a sign that the urinary infection is affecting the bladder and possibly the kidneys. But by ensuring that lots of fluid are taken on board, then hopefully that could cause that to sort of be washed through. Don't be afraid to ask for antibiotics for a urinary tract infection, but if someone's got an indwelling catheter, we already know that those bugs are there, so just to sort of be aware of that. If it's somebody who hasn't got an indwelling catheter in, it may well be that their urine output is just less, or it becomes more frequent, so they're needing to go more frequently, but the urine output is still is quite small amounts. So just to be sort of just vigilant with regards to that. Again, encouraging fluids regularly. We should all be drinking fluids regularly. I've got my glass of water here. And we should all be drinking water and fluids regularly. And if we can avoid the caffeine, as I said earlier, then that may well help. Another question is related to somebody who is having bladder symptoms, and what would they actually expect to happen to them when they get to the continence clinic? One of the initial things would be that as part of your bladder and bowel diaries that you may well have kept, that the nurse who's seeing you may well want to do a bladder scan. And what that would entail would be for you to go to the toilet and empty your bladder, and then the nurse will then measure using an ultrasonic scanner just to see if you're leaving urine behind, because it may well be that you're not actually emptying properly. Again, another possibility that could cause you to get a bladder infection. Depending on who it is and depending on who is actually discovered, if there is a residual being left behind, we would then look at making a decision as to what would be the best form of management for that. But if somebody is leaving somewhere between 1 to 200 mils of urine behind, that may well start to become an irritant to them, and it may well be that we need to look at emptying that out regularly to ensure that the bladder is being kept healthy. So we can then teach either the carer or yourself to actually pop a catheter in, maybe initially just at night time, to ensure that when you go to bed your bladder's empty. You then are much more likely to get a good night's sleep. If you have a good night's sleep, you're much more likely to get up the next morning feeling better, in terms of, hopefully it won't have affected your fatigue and things like that. So the possibility is that from a continence clinic, they may well find that you have got a residual, and they may want to manage that. The residual, if you're leaving a couple of 100 mils behind, that can actually start to have an impact on your bladder, and it will start to send messages of urgency, and then every time you go into the toilet you're only passing small amounts. And the other question was about accessing information, which is actually very similar to what Doro asked. I think if you are obviously computer accessible for being on the webinar, the googling your local continence advisory service, as I said earlier, and gaining as much information as possible to see if they've got an open access to clinic, that can actually enable you to access the service that you deserve, and will allow you to gain as much information as possible going forward. And that's actually all the questions. I'm going to clear the screen so you can actually see my contact details. If you want to contact me at all, then obviously I'd be more than happy to take your calls or to see you in clinic. As I say, the next one being Wednesday, the 24th of June. Between 10 and 2 I'm usually here, so I hope to see somebody then. Thank you.